I really appreciate. I mean, I'm just sitting here with all 77 people, and it just feels really great to be part of this community. And I'm really grateful for OCRA to have invited me. I hope some of you have had an opportunity to review the session on integrative medicine. And by far, I just wanted to say I am not an expert in oncology, especially in ovarian cancer, but as a woman and someone who's interested in integrative health, I was very excited to be part of this year's conference. So we had some great questions that were submitted, and I will go through those, and I think that will probably be, for next 30 minutes, we will be reviewing those. So the first question is, what are the thoughts on medicinal mushrooms containing polysaccharides and their effects on cancer? So they also asked about Rick Simpson oil, and I can say that I can talk about medicinal mushrooms that contain polysaccharides. And as many of you who have looked up mushrooms have found that mushrooms actually can, some of the studies show that they can slow down or stop cancer cells from multiplying, and yet there are so many caveats around that. So I think it's really important to make sure that first, the source is right. We know at the same time, there are people who actually have harvested mushrooms from, around the neighborhood and ended up in the ER with a liver toxicity. So I just want to, remind each one of us that it's really important to make sure that the source is correct. There are several brands out there, and you might say, okay, which one? So I can personally say, I have chosen a couple of them just because these are, brand names that are actually produced by mycologists. They're very interested in mushrooms. They understand all of it, the high quality, and so a Host Defense is one of them. I have no connection with them, and yet I'm really impressed by the Mr. Stamets, how much knowledge he has, and he comes highly recommended by Dr. Andrew Weil from University of Arizona. So that's about mushrooms. I would also say it's actually good to look at various products within a brand and see which one best meets your needs. If most of the studies were done on turkey tail mushrooms, and so if you find like there is a product that has multiple mushrooms, the difficult part is when you're working with your oncologist and there's something that's not going well, and you had just instituted a supplement, you wonder which one of those components were, maybe possibly, might be a reaction or so. So for those reasons, I would say keep it simple. Please make sure that you are letting your team know that you are taking a supplement, so they can look at that. They can also, your pharmacist can look at against other medications to make sure that it is matching well with the supplements and the medications. The second question is keto. So it says keto is being studied as a way to prevent metastasis and recurrence. What are your thoughts about it? And have you seen any early studies for ovarian patients? So I have to say, I've just reviewed most recently, so a lot of information that was on, we know some of the folks who've been studying keto, especially to help with the symptoms and symptoms or prevention or management, especially in the day of chemotherapy, and what is the carb intake. So I would say Victor Longo's work is really, Dr. Longo is a scientist who has studied this well, but not in the context of ovarian patients. So I would say if you're considering something, it's in lieu of maybe symptom management or side effects from one of the therapies, then it is a good idea again to speak with your team and something worth trying. At the same time, there are so many caveats, as we know. People may not be doing well, they might have lowered appetite, they may not be consuming as many calories, and and then missing out on a lot of carbohydrates, the healthy carbohydrates, could be also detrimental. So it really depends on situation to situation. But I would say it's definitely worthwhile, looking up the information and discussing then with your team to decide if you are a good candidate for that. The other question is, who would be the integrative medicine specialist who can assist with digestive challenges? So if you're thinking it's more around symptom management, side effects with nausea, maybe less appetite, change in taste, this could be any integrative practitioner who is trained in oncology. So I would say, as you might be aware of society, it's called Society of Integrative Oncology, SIO. So they are great, and there are practitioners who belong to that group. So maybe that would be a good way to access someone who actually specializes in oncology and integrative approaches. So that would be my suggestion to consider. So they may not necessarily have to be GI, gastrointestinal gastroenterologists. These could be integrative medicine. Now, if we have symptoms, and that can lead me to the next question about acupuncture. So I can say, acupuncture, as we know, if you look at NCI, National Cancer Institute, NCCIH, cancer.net, they all recommend, acupuncture could be utilized for peripheral neuropathy, chemotherapy-induced peripheral neuropathy. It can also help patients to actually have improved appetite, additionally mitigation of stress, which could be a reason for reduced appetite or some of those other GI symptoms that people might be experiencing. So I would say it could be tackled in many ways. We could tackle it by simplifying the food, making sure that it is something that is easy on the stomach. Are we incorporating some herbs or just condiments, culinary condiments like ginger, like turmeric, that is helpful for the gut? It actually, traditional Chinese medicine doctors and acupuncturists will call it tonifying your GI tract. So eating foods that are more plant-based, that are easy to digest, might be a good way to get started with managing some of those symptoms. And if still needed, then seeing someone who is trained in integrative oncology will be a good idea. The other question is, someone said they have used number of integrative medicine strategies, but I believe I'm missing a key component, leadership of my team. Where and how do I find the person to lead my integrative medicine team? So I'm assuming this is really to see like how to integrate medical team alongside with the integrative medicine practitioner. And it's easy when it's all on the same campus, because then people are able to see the same electronic medical record, so that when your integrative practitioner, medicine practitioner, is documenting, the rest of the team can see the recommendations and everyone can work together. However, it doesn't always happen. I mean, know some of the progressive organizations do have integrative medicine departments, and so practitioners can actually work very collegially, and it's quite streamlined. But when that is absent, I would say really having that introduction email by your integrative medicine practitioner, someone who understands the Western medicine, someone who can speak to it, and can engage with your primary care team member to access that information, and making sure that everyone is on the same page. So I hope I was able to make those suggestions, and I hope I was able to address this question in this way. So someone also asked about how should acupuncture be leveraged, and is it still recommended during the pandemic? So I would say, I personally have used acupuncture and have been just amazed with how good I felt every time I have accessed acupuncture. We know there are several acupuncturists who are very well trained in oncology and have safely been treating patients. And right now during the pandemic, they have certain, um, you know, um, 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 they've changed their operating procedure where they actually have only one patient per during that duration, so you will not see anybody else there. They have they're using masks, they're sanitizing the area, and they're using a very high quality um, air filtration system. At the same time, I would say, I probably wouldn't use acupuncture just to mitigate my stress. Right now, I would probably just hold off on that and use other methods of, mitigating stress. So it could be, meditation. It could be guided imagery, which we know healthjourneys.com, they do a very good job. Bella Ruth Naprostak is one of my favorite guided imagery person. So she's a good one for various symptom management. If you go into healthjourneys.com, you can actually see there are guided imageries for specific symptoms, and also for, so under oncology, there are several guided imageries that people can pick and choose for it. For example, I know I'm digressing. We asked about acupuncture, but I just want to talk about, like, there are other ways to also manage our side effects and symptoms. So guided imagery, for example, some people might see like, oh, my medication, this is something that causes so many side effects. Like, I just think, they might refer to it, even as poison or something, which is very contra, therapeutic. So if you can see this medicine as something that's going to just go into the body, that's going to take effect and do exactly what it needs to do, there is some magic around that, where some people have reported that they actually have fewer side effects, fewer symptoms, as opposed to others who might see this medication as potentially causing a lot of side effects. So I would say mindset is another one, guided imagery is one, of course, music, and there were other things that I had talked about in the in my presentation. So I hope with acupuncture, if it's really important, there's significant symptoms you're experiencing, and you are in the area, DC area, there are some very good acupuncturists, and they're listed on Sibley's website. And I'm sure there are also, OCRA and others have that information available as well. Other question was turmeric and milk thistle. How do we know what needs to be limited during treatment? So this is a very good question. I would say it's really important to have a good pharmacist, who can look at, so there's an app, as you know, Herblist, Herblist. There's an app. There are, several oncology practices, hospital programs that actually have places where you can put in your medication and search for interactions. But it's always a good idea to discuss that with your oncology team. What I feel more comfortable with is culinary use of some of the herbs. So ginger, turmeric, culinary use is much likely to be safer than actually taking capsules, unless it's, if there's no interaction. Then you could, take the curcumin, which is the supplement that is the actual active compound in turmeric. But otherwise, turmeric, just adding it into your food, if you're making scrambled eggs, or adding, having some kind of lentil soup or butternut squash with kale, or, some kind of poultry, salmon, chicken, you can add turmeric to it. As long as there's a little bit of fat around it, it actually gets absorbed well with a pinch of black pepper. So So I would say culinary use is more safer way to using some of these condiments. When I studied botanical medicine as part of my doctorate in nursing practice, it was like 3 pages long, just information about turmeric. And it's fascinating to see, what in synergy, without the curcumin. So just looking at all of turmeric, in synergy, how beautifully it can work for us. So incorporating into our daily lives and how we're eating and consuming some of the turmeric is a good way to, incorporate that in without having to do too many supplements. The other question was, what are the best resources to understand complementary supplements? So I would say, definitely looking at NCI's website. Sloan Kettering has a very good website. So looking at those to really understanding supplements, because not all supplements are created equal. I'm really concerned more, I'm leery about people doing a lot of supplements, because sometimes there is a lot of claims being made that are not necessarily proven, and it's a billion-dollar industry where people are buying lots of expensive supplements, and they could be potentially harmful, or they don't have the right ingredients in there as it was promised, what's on the label, or it can cause it might have some other contaminants, or it can also, there could be interaction with the medications you take. So I encourage you to, looking at the information through websites and seeing how best to, taking supplements. So making sure that you're actually doing a good review prior to consuming the supplements. And, definitely I would say, there are some supplements that really add value and help people, but it's not necessarily all created equal. So I think it's really important for us to be mindful of that and not necessarily believe everything that the label is promising. I think it's a good idea to look at the website, cancer.net, going to National Cancer Institute's website, looking at some of the credible programs, oncology programs, to see what kind of information is available on that. So I hope that answers the question. Other question was on acupuncture for peripheral neuropathy after chemo, and I can tell you it was just magical to see. Some people felt better. When I would see as a nurse practitioner and program director, people will come in to receive their acupuncture. It would sometimes take them 6 sessions, but other times within 2 sessions, 3 sessions, or up to 10 sessions, people start to feel like all this tingling and numbness, in their peripheral nerves, in the fingers and the feet, was improving, which is very encouraging because it is affecting quality of life. So I would say definitely there's a lot of evidence on that. Then again, it depends on who the practitioner is, someone who's trained in oncology, who has been seeing people with similar diagnosis and treatment, actually are, and then they know which points to access. There is more likely to then getting that acupuncture to work better. But I would say, please do not give up on that after you have just tried once or twice. And usually in the beginning, people have to come once or twice a week and do it for, at least 10 sessions or so to start noticing that there is an improvement. There is something in the chat, and it says from Samantha, my mom adds it to everything as I refuse to take any pill that is not certified by an independent source. Fresh turmeric is wonderful when added to food. So thank you, Samantha, for adding that comment. Indeed, I love fresh and powder turmeric, and it's a great way to add that, and it's very helpful for also the gut health. And lowering inflammation, so that's helpful. So that's for acupuncture. And I've heard, it says, I have heard to stay completely off animal fat, even milk and cheese, especially for estrogen-driven cancer like ovarian. Would like your input to see if it's indeed beneficial to completely avoid animal fat. So, there are lots of studies that have been done. We know that heme content is certainly, concerning. So there is, more in the red meat, there's higher heme content. So again, the best idea is to really meet with an oncology dietitian, someone who understands, all of the picture, understands your picture, and can make recommendations accordingly. But the temperature of how the meat has been cooked, how high the temperature was, can also be can influence how bad that food can be for us. So for example, if it's cooked at very high temperature, like 212 Fahrenheit, the chemical structure of the food changes, and that can be harmful for the body. So I would say, so we have to keep an eye on the heme content. So organ meats, red meat, things like that, maybe trying to avoid unless you are, very deficient in hemoglobin, you're anemic, and they're asking you to eat some red meat just to bump up, even though we know that green leafy vegetables and several other foods like prunes and figs and other foods can actually help with the iron production, but so sometimes you might have recommendations to include a little bit of red meat, but otherwise in general I would say, if you were considering some sort of meat, Dr. William Lee Li actually has a wonderful book. It's called Eat to Beat Disease, and in that book it's like this thick. In that book he has a section for cancer. So your library might carry that. So if there is an electronic book that you can review, have access to, it's called Eat to Beat Disease. And in that, he talks about poultry, and he talks about how thigh meat is better than breast meat, white meat. And so anyways, so that is, so there are some recommendations. I would say we know that, of course, animal protein and fat, of course, um, it depends on what our beliefs are, so my focus mainly every day is on how can I lower my risk for various cancers, and looking at how to lower inflammation. So looking at anti-inflammatory diet, that's listed on Dr. Andrew Weil's website. It's a good way to see, like, and he doesn't, have red meat on the food pyramid. It's more like tons of vegetables, lots of fruits, some, Asian mushrooms, medicinal mushrooms, to actually use them as cooked, and then lots of nuts and healthy fats. But they talk about poultry, so salmon, fatty fish, making sure that we're not incorporating too much of mercury, but also poultry, chicken is fine. So I would say, first concentrate on what is the temperature you're cooking your animal products at, what kind of animal products, is there, heme content, very high heme content, is there a lot of iron in it? So even though in ovarian cancer there are no studies, the meta-analysis of 8 cohort studies actually looked at animal protein, and they found no association with ovarian cancer and intake of red and processed meat. At the same time, when we're looking at other cancers and we're looking at all over well-being, we know that sometimes red meats and organ meats can actually be detrimental, not so good for the health. So I would say maybe we can look at like the bigger picture and not necessarily just say like, oh, this is, check, and they didn't see any relationship in ovarian cancer, so I could go ahead and eat. I would still like to know, is there any potential problems with other cancers? So as we know with breast cancer study, they found that, when people lowered their animal fat, they actually had lower risk of breast cancer. So I would use that information, then I would bring that into my daily food intake, dietary intake, and use really as much unprocessed whole foods as possible. I personally know when I eat, some kind of animal products, it's just takes longer to digest, longer to, get it out of the system, versus the plant-based food. So not to say that we all need to be plant-based. I think it's important to just see, like, maybe most of our calories can come from plant-based, and then we can incorporate some of the animal protein and other healthier fats from plants. So I hope that answered your question. We know that, also in meats, there is, with the heme iron, I just wanted to point out, there's choline content, and that choline actually increases the trimethylamine oxide, so TMAO, that actually increases inflammation. So for that reason, maintaining a lower intake of animal source is a better idea. Even though there are some studies then that say that, if we have more conjugated linoleic acid, it's helpful. So I would say, as long as we can keep it so simple that just eat a variety of plant-based foods and then supplemented with some very healthy poultry, that might be a good way to go. So that, we know that we're overall looking at well-being versus just what's exactly good or not good for ovarian cancer only. Thank you, Nancy, for sharing the in the chat section. I love Dr. David Schreiber's book on anti-cancer diet. There's also an anti-cancer living book by Dr. Lorenzo Cohen, who himself, very openly has shared about his own cancer, and that's looking at 6 different, aspects of our lives, including not only diet but also environment, water and relationships, nature and things like that, and exercise. So those are great resources. That's what's in the chat section. And also Dr. Lorenzo Cohen, Cohen, and his book is Anti-Cancer Living. In fact, there is a good program that has been pulled out of this book. So if you search for Anti-Cancer Living program, there is a donation of, I think it's like a cost of $20, and you can go through the program. It's online, and it's wonderful. I'm forgetting what hospital is offering that, but I stumbled upon it while I was looking for Dr. Lorenzo Cohen's Anti-Cancer Living. So something to consider, and it goes by various dimensions of life, and what can we do to maximize our well-being based on those. So great, lovely conversations. I know we're at 4:30 right now, and we didn't get to finish everything, but I hope this was a helpful session, and I'm wishing you all the best. And for all the caregivers and support people, I'm also thanking you from the bottom of my heart for being present and available. And thank you, OCRA, for allowing me to be with the community this afternoon.
Thank you.
Thank you.
Thank you so much.
Thanks, Harpreet.
Thank you so much. Thank you. Thanks.
Thank you so much. See you soon. Bye.
Thanks.
Thank you.
Bye, Barbara. Thank you, Barbara. Thank you.